And a first since the pandemic began, Greenlee County is COVID-free. No active cases as of last night. Here in the valley, the virus is still spreading. Maricopa County is about halfway through its sero survey, and the county says they need help getting people to take the antibody tests, and not just anybody can volunteer. ABC 15's Claudia Rupsich got an update on the project and what those results could mean for us.
Please consider participating.
Maricopa County health leaders need help. More antibody tests for the countywide sero survey.
It's quick. Only about 20 minutes for a single person and slightly longer if you have others in your household that participate. You can do it outside of your home or by making an appointment at our mobile medical clinic.
The goal is to get a more accurate look at how many people have been exposed to the virus by getting an infection rate beyond those who've tested positive for COVID-19.
There are a lot of these subclinical or asymptomatic infections that ultimately didn't drive these people to go seek health care. So unless we know how many people have been exposed, we don't know how severe those infections really are in our community.
Until September 20th, crews will knock on doors in 29 communities, zip codes specifically chosen by the CDC that reflect the county as a whole. So far, they've only reached 63 houses. The executive director for county health says they need at least 168 households.
What we have experienced is that a lot of folks aren't home when we approach their home, so we go back several times. We are still hoping to reach our goal. We're really pushing a blitz forward for the next few days.
The original goal was to reach 210 households and collect between 500 to 1,000 blood samples. The testing is to identify COVID antibodies. Those are proteins the body makes in response to a specific infection. Dr. Erin Coletta is testing the samples at the Mayo Clinic.
Once that antibody is produced, we don't know at this point yet how much immunity the patient would have from those antibodies or how long that immunity will last. But based on what we've seen so far about reinfection rates in other large cities that have had large amounts of exposure, there seems to be some kind of protective immunity that comes after a patient has been exposed to coronavirus.
There have been some privacy concerns about what happens to the blood once it's collected.
When I get the samples here, it just has a barcode and a number. I don't know who it is. I don't know whose sample it is. We're not saving them or destroying them as soon as they're tested.
If they don't get enough samples, it's possible they'll have to extend the collection period a few more days. They're hoping to have results by the end of the month. In Phoenix, Claudia Rupsich, ABC 15 Arizona.